The COVID-19 pandemic put our healthcare systems in crisis mode. For many people, that means interruptions to their routine care. But as this week's Doctor on Call will explain, it's important to keep up with your regular healthcare screenings. Joining us now via Skype is our Doctor on Call with TriHealth, Dr. Caitlyn Zinn. Thank you so much for the time today. I've talked to other doctors about this before. These routine healthcare screenings, while they sound kind of ho-hum routine, they really are critically important, aren't they?
Right, Julie. Yeah, thank you so much for having me. You're right. A lot of people have been putting this off, fears with COVID, coronavirus, but it is important because a lot of these screening tests and visits actually are looking for patients who don't have any symptoms and catching disease early. And so they are definitely more important as ever.
You're an OB-GYN, right?
Yes.
So, I mean, mammograms come to mind. I'm sure there are people putting those off. What else, because those are those appointments women have every year, at least once a year. What are you missing that could be very serious if you don't look at the calendar and get this on the calendar?
Right, you're right. So there was a little bit of delay due to the coronavirus, but now that we've opened back up and are seeing patients, definitely those mammograms help screening for breast cancer. And mammograms are a great example because they've actually been shown to decrease the risk of an invasive cancer and to catch that early when treatment is definitely available. As an OB-GYN, we also talk about cervical cancer screening, so those pap smears are important, as well as, just having patients coming in, checking their blood pressure, their weight, talking about other kind of health risks. So we're really encouraging patients to get back out there.
And so many of us have missed our workouts. The weather has not been fantastic until recently. Hard to get out, and so we've all gained weight. I don't want to think I'm the only one.
COVID-19.
Yeah. And so, when I was talking again to another ER doctor who said people don't get in when they have any symptoms that they could be headed toward a stroke or a heart attack. If you don't get in early, there's a lot that can't be undone.
Right, and so that's what you'll see patients who will say, I was feeling well, I wasn't having any symptoms, and that's exactly what these visits are for, before the average risk patient has any symptoms. And so this is a great time for us to kind of look for that, especially when the patient has any knowledge of that they're having any issues.
Remind us what you're doing, what you're seeing to make patients feel comfortable and safe to come in, that the measures are being taken to protect them from COVID infection.
Right. So at TriHealth right now, we're having all patients and all healthcare team members wear masks. Every patient that comes in we ask them like a screening questionnaire to kind of rule out any possible exposures or signs of COVID. We are limiting how many patients we're seeing in the office and definitely practicing that social distancing.
Okay. Thank you so much, Dr. Zinn. We appreciate your time today and just trying to keep getting the word out there that our emergency rooms and our doctor's offices are safe. We need to all make sure we take care of our health. Thank you for being with us. Have a good afternoon.
Thank you.
Okay.
You too.
All right, let's turn to our forecast now because we're looking at the